So I will present you some highlights from our experience in Romania with the Green Phone, a risk communication tool in the COVID pandemic. I will describe the context of setting up the Green Phone, followed by details of its establishment and organization, evolution and transformation, and some aspects about initial and continuous training of the Green Phone operators, their skills and competencies, and reporting activities illustrated with data analysis. I will end with a brief SWOT analysis and conclusions. Talking about the context, I want to remind you that the outbreak caused by the emergence of the new strain of SARS-CoV-2 was rapidly declared as a public health emergency on 30th of January by WHO. From the initial phase of the pandemic, we know there were many unknowns about the new virus and the disease, how it is spread, the rate of transmissibility, the symptoms and the severity of the disease, and how to prevent the transmission of the virus. The new public health emergency and crisis, with an impact on public health worldwide, had led to difficulties and challenges in terms of how to communicate the known data and risk to the population. Communication should be made on time, especially as the number of cases was rapidly growing and spreading across countries and continents. New information actually become known, and recommendation changing. How the Green Phone was established, in fact, and how it was organized. The dedicated telephone line, the Green Phone Coronavirus, appeared as a necessary tool in the communication process during the COVID-19 pandemic. It was established by decision number 2 from 24th of February 2020 of the National Committee for Special Emergency Situations to support the population with information on prevention measures, signs and symptoms of SARS-CoV-2 infections. The first COVID-19 case in Romania was announced actually 2 days later on 26th of February 2020. The Green Phone, it is managed by the Ministry of Health through the National Institute of Public Health, and the technical resources necessary for its operation are provided by specialists of the Special Telecommunication Service. How the organization of the Green Phone evolved and what transformation have been in place. From its establishment until now, in the conditions of the evolution of the epidemiological situation determined by the spread of SARS-CoV-2 at the national level, in order to ensure appropriate risk communication, the Green Phone Coronavirus line has undergone several transformations as following. Regarding the number of the phone stations, initially were 5 phone stations, then 10, 15, 60, 5, and currently are 7 stations. The location was initially in the National Institute of Public Health headquarters, then in the National Arena, a very big stadium in Bucharest, then again in the National Institute of Public Health headquarters, and currently is in the headquarters of the Institute, and additionally in two regional centers of public health in Sibiu and Cluj. The operating staff also was diverse. At the beginning, we have been only medical staff from the National Institute of Public Health, then several resident medical doctors of different specializations, and also medical staff from the Ministry of National Defense. The operations schedule was adapted also during the time. Initially was between 8 a.m. and 23, including Saturdays and Sundays, then in 3 shifts, 24 hours, 7 days in a week. And now the schedule is from Monday to Friday between 8 and 20. Initial training of the operators included informations about signs and symptoms of the disease, prevention measures, official sources of information, areas of high epidemiological risk, case definitions and testing algorithm, the plan of measures at the level of the health system, and general guidance for communication by phone in a crisis. It appeared truly clear that in the context in which the information is new and is updated, at an alert pace, depending on the dynamics of the epidemiological situation. Both National Institute of Public Health staff and residents, and actually all the green phone operators needed regular training. So daily pre-shift training of 10 to 15 minutes was organized and included update data on the evolution of the pandemic and changes in legislation to prevent the spread of the epidemic. Each telephone station has a folder that contains essential up-to-date information, and there is also a virtual WhatsApp electronic group where new information is available for all those who are involved in the green phone operating. A few skills and competencies of green phone operators we have learned that are needed for effective communication. They must show confidence, calm and trust, consistency, compassion and authority. And they have to be as fully informed as possible because the problems are diverse. They have to quickly integrate new information into their answers, and they have to link actually between the population and the health system, respectively the health services, but also with other systems such customs, internal and external affairs. They have to improve their understanding of people's perceptions, attitudes, and clarify their concerns. And they have to provide public health advice, counseling, and or referral to other services. They, meanwhile, have the opportunity to learn about risk communication and improve their skills. And despite that, many times the reporting activities have been seen as an administrative burden, operators completed always a report at the end of the shift with the most frequent asked questions of the population, making possible the synthesis and formulation of answers to the most frequently or difficult questions. In the end of this analysis of the reports contributed to the evaluation of the green phone service. The range of questions is extremely diverse, from questions related to the sign of the disease, testing, attitude in case of illness or immunity generated by the new virus, to questions related to the application of existing regulation on quarantine, testing, paraclinical evaluation and monitoring, travel, and access to health services. Here are some synthetic figures about the activities of the green phone until 29th of May 2021. There have been 459 days since establishment, with 352 days with reported calls. 480,648 calls have been received until now, approximately. On average, 1,365 calls received per day, with a maximum of 10,024 calls registered on 26th of March 2020, and a minimum with 437 calls registered on 31 of December 2020. Here you can see the curve of the number of calls answered at green phone on between 28th of February 2020 and 29th of May 2021 with green color. And you can notice that this curve is not overlapping with the one of the number of new COVID-19 cases daily confirmed in the red color. What we have noticed that the number of calls was higher in the time of emergency state, when several military ordinances were issued to regulate the public life and the lockdown. Also, the number of calls increased at the dates when the list of countries with high epidemiological risk is published, usually weekly, on the website of the National Institute of Public Health. The increase in the number of calls was noticed around the events, some events such as school openings or local elections. And also was an increased number of calls associated with the provision of a decision of the National Committee for Emergency Situations that allowed some exception from quarantine, and in the same time with the number of those tested positive increased. We have identified some strengths of green phone that provides a quick response and cover a large geographical area. It addresses to a wide range of audience segments, men, women, different age groups with different educations. It is versatile, can be used both to empower and to shape the population behaviors. It is very useful for disseminating information in the situation of maintaining social distance, both for urban areas with high population density and for remote areas difficult to access. It is a useful tool for population without digital skills, and it uses medical trained staff. Some of the weaknesses of the green phone are that require significant effort for resource planning, dedicated staff, continuous effort to coordinate information, recommendations or response, and information management. Threats are related to the fact that may exclude people without a telephone or from areas with poor mobile network coverage, or those who cannot afford to call when the line is not free and requires budget and well-trained and human resources. Still, there have been some opportunities. The concern related to offering to the staff the chance to understand the perceptions and behaviors of the population, to collect information about real-life problems in the pandemic and can be used to improve field interventions, and offers to public health professionals information about activities from other sectors that influence the epidemic evolution. Three brief conclusions. The risk communication started slightly before the public health emergency. It reaches a maximum during emergency state, but must be continued even after the crisis is over. Good communication leads to positive reactions from the population and adherence to recommended preventive measures in response to the emergency. And for all colleagues involved in green phone activities is both a tool through which to achieve the risk communication and an opportunity for practical learning of risk communication. Here you can see some mass media promotion. The green phone was promoted on the website of WHO. Actually, the WHO regional office for Europe through our national Romanian office supported in the beginning setting up this green phone. Then the promotion was done also on different medical journals, on different press agencies' website, and website of different medical institutions. So thank you for attention.